Good morning, good afternoon, good evening to all the participants. I would like to take just a few minutes to give a perspective to the training as a whole. Now, even though this is aimed for the trainers, it's important that all of us get the right perspective. And I bring this perspective from overall perspective as more as a manager from that. So first is to recognize that in this realm of AOP training, all learning or training is towards application. No, we are not doing this in a vacuum. No, we know exactly what they're supposed to be doing. It is towards building skills, and towards that we need to be kind of comprehensive in all the inputs that we give to the person. Certainly knowledge is one, which largely happens through in a classroom setting. Of course, the skill development is the core part, which is the doing part. And then because the caregiving process in eye care or pretty much in everywhere is part of a team activity. There is the lab involved, there is investigations involved, or refraction or vision. People are doing different things. So documentation becomes very critical, because documentation is the tool that we have to communicate within the team of what you have done on the patient. And then it is equally important that we have the right attitude as we approach any of the skills. Now, of course, there will be nuances based on what exactly you're going to be doing. And in many ways, I think this is what distinguishes compassionate, good staff or a good worker from someone else. So we have to recognize that skill building has got to be comprehensive. It is not mechanical doing something, so the knowledge part helps in that. It is also doing it with the right kind of a compassion and recognizing it is being done on another fellow human being. And whatever we develop as skills must match what we are planning for them in the workplace. And then what is also equally important is to recognize that because we are doing all this training for developing skills which are used on patients. So we need to have a robust feedback mechanism from patient care to training, what worked well, and more importantly, what did not work well, so that the training can be augmented. And then if it is done well, we will create a good synergy. Now, because of the nature of the training that is involved, we necessarily have to interact with the patients, in developing the staff. And so for that to really sustain, Usha mentioned about sustainability, from one perspective, for the training to sustain and become stronger, we have to create synergy between training and patient care, not compete for the resources. And I think that's one way we can make sure the training becomes better, and introducing this feedback loop is very critical. And I'm sure you'll get insights as to how this can be done as we go along. And quite often when you do the training, we introduce a certain level of inputs to the trainee or to the student, and then we would leave quite a bit of the skill development to experience. In the sense, it's all about where do we draw the bar or the baseline, saying that this is good enough for the trainee to know. The rest they can learn on the job, through experience. So this is kind of not written down, but this is what happens in practice. And there is no question that experience is a teacher, it will kind of grow the individual or the staff. But then we can also challenge ourselves to say that, can we bring a fair bit of what we live for learning by experience into the core curriculum? I believe it is possible. And I think it may require some innovation and more than that, certain mindset. Now, if we do that, we can possibly, like today in the day of frequent turnover and things like that. So we can make sure that a person who finishes 2 years training as an AOP and graduates can actually have the skills of say a 5-year experienced AOP. I believe it is possible. I mean, so that they can deal with more complex conditions and more challenging situations, which I believe will also augment the learning as well as challenge both the student and the trainer. And to conclude, I want to kind of mention the trainer's mindset is also important. Now, towards that, I would like to ask the participants a question. What should be the pass mark for graduation? So you have a poll that has popped up. Kindly choose whatever is your answer. This will be on for a few seconds before they close it. So this is interesting. There are people who have said, a third of them have said 50% is adequate. Another third said 70%, and about a quarter have said 80%. So it will be good as trainers for us to reflect on this mindset. So are we saying that it is okay for the trainee to make mistakes half the time or 30% of the time? And imagine and recognize that it is all on patience, where you don't have a second chance. So would you train, or would you be willing to be subject to such a staff who will make mistake half the time or even 20% of the time? Would you be willing to undergo investigation or a training if this is the case? And I'm sure you will say, no, I don't want the staff to make any mistake on me, on training or whatever. So I think this is, if that is the expectation in workplace from others, that is what we should also demand from our own trainees. So can we set the target that it is 100% which becomes the pass mark? No. So immediately how you do this will change. I think that will be talked about formative and summative assessment and things like that. So our goal is not to pass or fail a candidate. Our goal is to make someone who's perfect in whatever we are teaching them to do. I think this is as much as a mindset. So in conclusion, I just want to reiterate, I think that the trainer's mindset is as important as training technology, which you will learn quite a bit, different pedagogic techniques, again, which you will learn a lot, and about the content, in which I think many of you are fairly familiar with. So this 2-day program is to give some high-level appreciation for this whole process, so that each one of your organization can have excellent trainers and through them excellent staff being produced. Thank you and good luck.